Assalamu alaikum students, my name is Busha Khan and I'm going to teach you biology. The topic of our lecture is respiratory disorders. This topic is taken from chapter 10 gaseous exchange of grade 10. Now the first disorder is bronchitis. What is bronchitis? The inflammation of the bronchi or bronchioles is called bronchitis. Means the swelling of bronchi or bronchioles is called bronchitis. How it is called bronchitis means its outcomes include it results in excessive secretions of mucus into the tubes, leading to the tubular walls and narrowing of the tubes. When mucus secretions are more than limited amount and it causes narrowing of the tubes, then it is called bronchitis. Now, what are the causes? It is caused by viruses, bacteria, and those chemical irritants for example, tobacco, smoke. Here, diagram of normal bronchus is present and the inflamed bronchus. When bronchus is inflamed or inflammation is done in bronchus, its shape is like that. Then we have two types of bronchitis. There are two major types of bronchitis. The first one is acute and the second one is chronic. In acute bronchitis, the disease lasts or continues about 2 weeks. It is long lasting but 2 weeks, and the patients recover with no permanent damage to the bronchi or bronchioles. Then we have chronic bronchitis. In chronic bronchitis, the bronchi develop chronic inflammation, means it continues about for 3 months to 2 years, and the majority of people diagnosed with chronic bronchitis are at the age of 45 years or later. Its symptoms include cough, mild wheezing, fever, chills, and shortness of breath, especially when they are doing some exercise or hard activity or job. The next disease we have is emphysema. Emphysema is the destruction of the walls of alveoli. We have already studied that alveoli are present inside the lungs in the form of group or clusters. So when the destruction in the walls of alveoli are done, that disease is known as emphysema. Now its outcomes. It results in larger sacs but with less surface area for gaseous exchange. When the destruction occurs in the walls of alveoli, larger sacs are produced with less surface area. Now, what happened? As a result of that, lung tissue breaks. Lung tissue break होंगे and the lungs do not back to its original shape after exhalation. so air cannot be pushed out and is trapped and locked down in the lungs, so exhalation is not done and air is trapped. So that disease is called emphysema. Symptoms include shortness of breath, fatigue means tiredness, recurrent respiratory infections means repeatedly respiratory infections are there, weight loss. Now, appearance of symptoms. By the time the symptoms of emphysema appear, the patient has usually lost 50 to 70% of lung tissue. Means जब तक emphysema की symptoms appear होंगी, patient अपने जो है 50 से 70% lung tissue जो है वो lose कर चुका होगा. So it is very serious disease of respiration. Serious complication, the level of oxygen in blood may get so low that it carries serious complication. और उसका रिज़ल्ट क्या होगा कि आपके ब्लड में ऑक्सीजन का लेवल जो है वो इस हद तक लो हो जाएगा कि अदर कॉम्प्लिकेशंस जो है वो प्रोड्यूस हो जाएंगी. Now the next disease is pneumonia. Pneumonia is actually the infection of lungs. What is double pneumonia? If this infection affects both lungs, this is called double pneumonia. Common causes कौन सी हैं? The most common cause of pneumonia is a bacterium. The name is Streptococcus pneumonia. Other causes में आते हैं viral infections and fungal infections too. Mode of infection. What is mode of infection? That is actually way of infection, that how the bacteria or the other factors infect living organism and cause pneumonia. When the causative organism enter the alveoli, they settle there and grow in number. Means causative organism, that organism which cause disease. So when the causative organism enter the alveoli, जब भी causative organism alveoli में enter होगा, ये वहाँ पे settle down हो जाएगा और अपना नंबर प्रोड्यूस करना शुरू कर देगा, ग्रो इन साइज एंड इन नंबर. दे ब्रेक द लंग टिश्यूज़, जिसका रिज़ल्ट क्या होगा, ये हमारे लंग्स के टिश्यूज़ को डैमेज करना शुरू कर देगा और फाइनली हमारे लंग टिश्यूज़ जो हैं वो ब्रेक हो जाएंगे एंड एरिया बिकम्स filled with fluid and pus. Here normal alveoli is shown and the alveoli which is filled with pus is shown in below circle. Now the symptoms of pneumonia include cold, high fever, shivering कांपना, cough, sputum production, that is saliva production, and short of breath, that is actually breathing problem. What happen in this condition? The skin color of the patient may change and become dusky and purplish. It is due to the poor oxygenation of blood. पेशेंट की जो स्किन का कलर है वो डस्की यानी फेक और येलोइश हो जाएगा या एटलीस्ट पर्पलिश हो जाएगा। अब ये कलर क्यों होगा? ड्यू टू दी पुअर ऑक्सीजनेशन, क्योंकि लेस ऑक्सीजन होगी ब्लड में, जिसकी वजह से पेशेंट जो है वो डस्की या पर्पलिश स्किन के साथ होगा। प्रिवेंशन क्या क्या है इस डिजीज़ की? वैक्सीन्स आर अवेलेबल टू प्रिवेंट नमोनिया कॉज बाय स्ट्रेप्टोकोकस नमोनिया। वैक्सीन्स जो है वो अवेलेबल हैं। ट्रीटमेंट क्या क्या है? इफ़ द पेशेंट इज़ survive with pneumonia, antibiotics are used in the treatment of this type of pneumonia. Fatal disease. Prior to the discovery of antibiotics, antibiotics की discovery से पहले जो है 1/3 of the pneumonia patients died from this infection. That is why it is called fatal disease. Now we have asthma. Asthma, what is asthma? Asthma is a form of allergy. Its outcomes include inflammation of bronchi, more mucus production, and narrowing of the airways. In asthma patient, the bronchi and bronchioles become sensitive to different allergens. When patient exposed to any of such allergens, the sensitive airway shows immediate and excessive response of constriction, and in this condition patient feels difficulty in breathing. Constriction means narrowing. आपका एयरवे जो है रेस्पिरेटरी सिस्टम का नैरो हो जाता है, कॉन्स्ट्रिक्ट हो जाता है, और पेशेंट जो है वो ब्रीदिंग में डिफ़िकल्टी फील करता है। एलर्जेंस कौन कौन से हो सकते हैं जो कि एस्थमा कॉज करते हैं? द एजेंट्स दैट कॉज एलर्जी आर कॉल्ड एलर्जेंस। फॉर एग्जांपल डस्ट, स्मोक, perfume and pollen. Now we have symptoms. Symptoms of asthma vary from person to person. They are not same in every person. The major symptoms include shortness of breath, especially with exertion or at night. Wheezing. What is wheezing? Wheezing sound when breathing out. जब इनहेल और एक्सहेल आप करेंगे तो आपकी इनहेलेशन या ब्रीदिंग के साथ एक साउंड प्रोड्यूस होगी. दैट साउंड इज कॉल्ड wheezing sound. The third symptom is cough, and the last one is chest tightness or chest pressure. Now we have treatment. The chemicals which ability to dilate the bronchi and bronchioles are used in the treatment of asthma. Such medicines are given in the form of inhalers. जब आपका एयरवे जो है कॉन्स्ट्रिक्ट हो जाएगा और उस पेशेंट को ब्रीदिंग में डिफ़िकल्टी फील होती है, तो थ्रू inhalation or by the use of inhalers we give medicine to that patients so that they can breathe easily. How he can breathe easily? By the dilation of bronchi or bronchioles.